Head and neck cancer. Head and neck cancer is a term used to describe a variety of malignant tumors that occur in the head and neck region, including the throat, mouth, nose, and sinuses. This type of cancer can cause significant morbidity and mortality, and is often associated with a high degree of treatment-related toxicity. In this presentation, we will review the key aspects of head and neck cancer, including its epidemiology, diagnosis, and treatment options. Head and neck cancer accounts for approximately 3% of all cancer cases worldwide, with an estimated 890,000 new cases diagnosed each year. The incidence of this cancer is higher in men than in women, and it is most commonly diagnosed in individuals over the age of 50. Risk factors for head and neck cancer include tobacco use, alcohol consumption, and infection with certain types of human papillomavirus, HPV. The diagnosis of head and neck cancer typically involves a combination of physical examination, imaging studies, and biopsy. Common imaging modalities used to evaluate head and neck tumors include computed tomography, CT, magnetic resonance imaging, MRI, and positron emission tomography, PET. Biopsy is the gold standard for the diagnosis of head and neck cancer, and may be performed using a variety of techniques, including fine needle aspiration, FNA, and incisional or excisional biopsy. The staging of head and neck cancer is based on the size and extent of the tumor, as well as the presence of regional or distant metastasis. The most commonly used staging system is the TNM system, which takes into account the tumor size, T, presence of lymph node involvement, N, and presence of distant metastasis, M. The stage of the cancer is an important factor in determining the prognosis and treatment options for patients with head and neck cancer. The treatment of head and neck cancer depends on a variety of factors, including the stage and location of the tumor, as well as the overall health of the patient. Treatment options may include surgery, radiation therapy, chemotherapy, or a combination of these modalities. The goal of treatment is to cure the cancer when possible, or to control the disease and improve quality of life for the patient. Surgery is often the preferred treatment for early-stage head and neck cancer, and may involve removal of the tumor and surrounding tissues. More extensive surgical procedures, such as a radical neck dissection, may be necessary for tumors that have spread to the lymph nodes or other nearby structures. Surgery can be associated with significant morbidity, and may require reconstructive procedures to restore function and appearance. Radiation therapy is often used in combination with surgery or as a primary treatment for head and neck cancer. The goal of radiation therapy is to deliver a high dose of radiation to the tumor while sparing normal tissues as much as possible. Radiation therapy can cause significant side effects, including mucositis, xerostomia, and dysphagia. Chemotherapy may be used in combination with radiation therapy or as a systemic treatment for advanced or recurrent head and neck cancer. The most commonly used chemotherapy drugs for head and neck cancer include cisplatin, fluorouracil, and taxanes. Chemotherapy can be associated with significant side effects, including nausea, vomiting, and bone marrow suppression. Palliative care is an important aspect of the management of patients with advanced or recurrent head and neck cancer. The goal of palliative care is to provide relief from symptoms, improve quality of life, and support the patient and their family. Palliative care may include pain management, nutritional support, and psychosocial interventions. In conclusion, head and neck cancer is a significant health problem that requires a multidisciplinary approach to diagnosis and treatment. The prognosis for patients with head and neck cancer depends on a variety of factors, including the stage of the cancer and the overall health of the patient. Advances in diagnosis and treatment have improved outcomes for patients with head and neck cancer, but continued research is needed to further improve survival and quality of life.